everyone. We'll just go through one by one from
Testing.
very good, my left all the way. So we'll get Dr. Lau. Dr. Lau, can you just introduce yourself in what kind of job, what kind of work do you do in the hospital?
Okay, professionally, in terms of my work, I'm a doctor in private practice, doing mainly work in the area of cardiology, cardiovascular problems, and also some of the other things which are related, as I mentioned. If you talk about high blood pressure, there are so many other related conditions. We should manage our patients as a whole. So sometimes they may have a problem with their diabetes as part of treatment of high blood pressure. We also advise them with those other related conditions.
All right, thank you very much. Associate Prof. Doreen, tell us a bit more about your work.
Hi, good afternoon. I'm a pharmacist by training. And for the most part of my life, I was a hospital pharmacist and I saw a lot of heart patients, whether they had a heart attack or whether they had a weak heart, or what we call heart failure. And managing high blood pressure or hypertension is a very common condition that we work with. So I feel very strongly about how we should be having an open dialogue about how you think about your medications. For most of our patients, we always tell them if you have questions or problems, it's always best to talk to us first rather than stop medicines on your own. And that's like my favorite line to all our laypersons. So now in a midlife crisis, I always say, I went back to the university to be a teacher. And now I teach a lot of pharmacy undergraduates as well as postgraduates on the topic of heart-related matters, on medication use, and also how to measure blood pressure accurately, like Prof. Lau has been sharing with the public earlier. Thank you.
Thank you. We're most happy to have you with us. Also, Natalie, tell us more about your role.
So hi everyone, I'm Natalie, dietitian from Singapore Heart Foundation. So really happy to be here today to have an open dialogue with everyone to share about heart health tips and also how to lower our overall blood pressure. So I'm part of the dietitian in our SHF Heart Wellness Center. So we actually see at-risk individuals as well as cardiac patients as well to support them in their rehab journey so that they can recover well with us and also prevent any future recurrence of their cardiac event. So really happy to have all of you here today and looking forward to share a little bit more about heart health and with regards to nutrition. Thank you.
Thank you, Miss Natalie. Up next, Miss Rachel Stevens. Tell us more about what you do.
Hi, good afternoon, everyone. My name is Rachel. I am the senior physiotherapist working at Singapore Heart Foundation working with all our clients. So the main group of clients that we take at Singapore Heart Foundation are cardiac clients or people with cardiovascular risk factors. So they are at-risk individuals or developing heart disease. And we see them and we teach them about exercise, how they can exercise effectively and safely to allow themselves better and to recover at a better pace rather than just going on their own and putting themselves at risk of danger. So I work very closely with Natalie because together we are in the Health Wellness Center. So they come to see me. They will also come to see her for the dietary side. So thank you all for coming today, and we hope that you will learn something about how you all can look after yourself and maybe even teach those that you are close to at home. Thank you so much.
All right, thank you, Rachel Stevens. All right, now first two questions for Dr. Lau. Now, from your observation, is it true that the trend of patients being diagnosed with high blood pressure is becoming younger? What factors do you believe are contributing to this increase in high blood pressure with young people?
Okay, I think it's not just a single factor. As I mentioned just now, with high blood pressure, there are quite a number of predisposing factors. I think one of the likely contributory factors is actually the question of diet. Many people, in actual fact, I think eat out, don't cook at home. It's a bit difficult to choose your diet to make sure it's low in salt when you eat out. And so that's one of the factors. Also, a lot of younger people now work long hours. As you know, working hours in Singapore sometimes can be very long. Not enough time to go and exercise, together with excessive calories, long hours of work, lack of exercise, become overweight. Overweight itself then predisposes to high blood pressure as well.
Well, very true, because I do see a lot of young people right now, they work very late hours and they eat a lot of fast food in between. They don't eat cooked food. So that's the contributing factors to young people having hypertension. In fact, speaking of hypertension, a friend just passed away today. He's 35 years old. Very, very young indeed. So it does happen to younger people right now. Very common. Next question. Is it true that having a family history of hypertension means that you will eventually develop the condition? Is it related to family history?
Most of the time, it is not a one-to-one. It doesn't mean that you got family history, 100% you will develop hypertension. As I mentioned just now, hypertension has quite a number of different factors. And so the fact that you have a family history means that you may have a genetic predisposition, but it's not 100% certain that you will develop hypertension. But it means that if you have a family history, you need to be extra careful about all the other things that contribute to hypertension, and make sure that you get a blood pressure measured at an earlier age and more frequently.
Okay, well said. So that means you can still have a chance to change your lifestyle, perhaps. Huh? You can't change your DNA, but you can change your lifestyle. All right, now question to Natalie. Is it true that switching a vegetarian diet can help to lower blood pressure to a normal level? Some online articles mention that taking bitter gourd can help to lower blood pressure. Is this true or is it a myth?
Okay, so with regards to vegetarian diet, what we actually see in the principles of a heart-healthy vegetarian diet is that it focuses a lot on plant-based foods. So things like it's really rich in fruit and vegetables, whole grains, and also plant proteins such as tofu, nuts and seeds. So this overall diet is generally lower in processed meats, refined sugar, saturated fat from fatty cuts of meat. So it's actually the dietary pattern that we're actually looking at based on the research that have actually shown that incorporating a more plant-based diet can actually lower our overall risk of hypertension because of the different varying components that comes with a plant-based diet. So eating a vegetarian diet doesn't mean that it automatically means that it's heart healthy, because we can also eat processed foods like chips, soft drinks, even sweets and chocolates. They are also part of the vegetarian diet. Okay, so instead, we really want to focus more on the key principles when it comes to a plant-based diet. So the research is really strongly advocating a of half plate filled with fruits and vegetables, okay, and a quarter plate, preferably whole grains, because they are really, really rich in fiber. So whole grains now, there's actually a wide variety. I think a lot of us are very familiar with brown rice, okay, but there are different variety like even barley, millet, buckwheat soba as well. So we can actually incorporate different elements of whole grains into our diet. And also, of course, lean proteins. So plant-based proteins, you can go for things like fresh tofu, tempeh, nuts and seeds. And of course, even lean protein like lean meats, fish is definitely a good idea as well. So it's not necessary per se to jump into a whole new diet, okay, because what we are really looking at is about lifestyle sustainable changes. So just one step at a time, by even just incorporating one new vegetable into your meal in each day can be a really good start. And I love that question about the bitter gourd. I think we hear a lot about that, about different foods that actually can lower our blood pressure. But based on research that has been found, there has not been actually a significant effect of bitter gourd with its results to hypertension. Okay, and more long-term studies are actually needed to see this cause and effect in order to show that it's proven to lower hypertension risk. But of course, having a wide range of fruits and vegetables from different varieties has been already proven to actually lower our risk of hypertension. Yes.
Okay, so I hope that answers the question. All right, now for Dr. Doreen. Is it true that negative effects of taking high blood pressure medication outweigh its positive effect?
That's a very common question we hear from the lay public whenever we start them on medications. Now, in medicine, whenever we start people on medications, we always start them because there are more benefits then there are more harm. So essentially, the whole statement about there being more harm, right, is definitely not true. Essentially, it's very important for everyone right here. I think you might have seen a newspaper article just a couple of days back about discussing prescription medicines with your doctors and the pharmacists, right? So the more important thing that everyone needs to be doing today is really to understand why the medicines are being started in the first place. So if you have a conversation with your prescriber, you can learn more about the medication and its effects, and also what the complications are that we're trying to avoid, in order to know why the benefits is for you, rather than worry about the side effect profiles of medications.
All right. Next question for Ms. Rachel Stevens. Now, can you just show us some basic exercises for people who are on wheelchair bound, that they can do at home or in the office?
Okay, so I would take that for wheelchair, we are mainly saying that if you're most of the time in a seated position. So I know that especially for office workers or those who are bound to a chair, you find that it is not exercise if I'm not moving, if I'm not standing, but that is not true. Even for our own patients, our own clients who are coming into Heart Foundation, or where I used to work in a hospital, we still prescribe chair-based exercises. Even if they are as simple as marching in the chair, it gets some activity, it gets the blood flowing, and it gets the legs moving, which is the most important thing. Because what we are most fearful for is that if you do not move at all, that's when your muscles start to weaken, that's when it starts to waste, and that's when you begin to realize you have a lot of stiffness, you have a lot of tightness, and that's when you'll find that functionally you get very limited. So for, let's say I take, let's break them up into two groups. Let's talk about the healthy population who are just desk bound, working in the office. A lot of them will say that a lot of neck pain, a lot of tightness here, arm pain, especially for those who are carrying their laptop bag out of the office, into the office. Important things that you need to do are all your neck stretches to stretch it out. A lot of the times you're looking straight into the computer. And to be fair, none of our offices are Singapore encourage our correct ergonomic way of sitting. All of the time, the desk is too low, the computer is too high up, and you're in a weird position. So we always recommend our clients to try and change as much as they can. It could be lifting up the keyboard, moving the computer desk, moving the laptop nearer to you, getting a separate monitor, and then, of course, doing whatever arm exercises you can do seated. As and when you can, do some simple leg movements. It could be kicking. For those with, I know this is mainly talking about high blood pressure, but a lot of the times when you're seated in a position for too long, some people may experience the effect of suddenly standing and feeling a little bit giddy. So when this happens, it's very important to do some simple ankle movements, in which your ankle moves up and down to help generate the blood from the feet to come back up to the heart. So these are very simple things that you can do seated, but if you can, you might find that there is some benefit and some relief to what you're experiencing.
All right, that's a very good answer. In fact, we have many guests who are seated here for quite some time. So before you stand up, make sure you wriggle a little bit before standing up suddenly, yeah? Okay, talking about dizziness and all that, I have a question here. I'm not sure which one of the panel will be able to answer. This is from the audience. They were asking if I have low blood pressure and experience giddiness, will taking glucoline helps me with my giddiness? So I'm not sure which one will be able to answer this very unique question.
Taking glucosamine.
Yeah, glucoline. I think it's a
Glucoline
sugar.
is a brand of glucose.
Yes.
Brand of, if you're talking about glucoline, no, it doesn't help your blood pressure. It only increases your blood sugar, may make you fat, and if you're diabetic, makes your diabetes worse. So please, if your blood pressure is low, don't go and take glucoline. If you're talking about glucosamine is another type of medication, not frequently used. It tends to be sometimes prescribed by people for improving the lining of your joints, the cartilage of your joints. Again, glucosamine, over the years, with a lot of research, has been shown to be not really very effective. It is something that you take and it's excreted usually in your stools, in your urine. It doesn't really go to your joints and improve your cartilage.
All right, so two answers in one there. Okay, so glucosamine and glucurin are two different things, yeah? Yeah. Okay, so next question for Natalie. Is it true that Himalayan pink salt is a lot healthier than regular table salt, which can help with the regulation of blood pressure? This is a very tricky question. Huh? Nowadays, you see the Himalayan salt everywhere. You buy them. Some buy in dozens. Huh? So tell us if it's true.
Yeah, amazing. So I think now we actually see a lot of different kind of salts in the market. So for that, it's actually a myth. So Himalayan pink salt and regular table salt, 1 teaspoon is actually comparable amount of sodium content. Okay, so Himalayan pink salt, of course, with the natural processing, that might retain minute amount of trace minerals such as potassium, calcium, and even magnesium. However, the amount that we consume is not truly able to confer much health benefits. So we still encourage to have our vitamins and minerals derived from a heart-healthy diet, okay, that's filled with fresh fruits and vegetables and whole grains, instead of relying on salt intake. So it's also important to be mindful that the recommended sodium intake is 2,000 milligrams a day, which is actually less than 1 teaspoon a day. So before reaching out to that salt shaker, if you enjoy Himalayan pink salt, do reach out for different fresh herbs and spices as well, such as onion, garlic, ginger, and even different herbs and spices like thyme and oregano to increase the flavor in your meals instead of reliance from your salt. Yeah.
Very good. Yes, you can add in.
I just wanted to jump in here. I think there are preparations like pan salt and low salt in the market, which contains potassium in them. And that's the main way that they make the salt salty. Now, the concern with potassium is that it could potentiate the side effects of a certain class of medications that are used for blood pressure, which are called the ACE inhibitors or the angiotensin receptor blockers. So for those of you who are on those medications, please be very careful about choosing your salt wisely. When they have that pyramid, doesn't always mean it's suitable for everybody. It's fairly important to know what you're actually consuming.
All right, very good answer. Now back to you again, Dr. Doreen. Can I stop taking the medicine or reduce the dosage if my blood pressure is under control?
Yes, that's a very common question. A lot of patients say, oh, so can I stop my medicines now, right? So I'd like everyone to think about your blood pressure, right, as a whole system, like a piping system throughout our body. So essentially our heart being the engine is like the source of the water or the blood, right, that pumps around. And all the vessels in our body, right, are like the piping that moves around the body, right? So when you have high blood pressure, it's either because your piping is now become too stiff and therefore they cannot expand as well, or you have this relative blood volume that is too high when you eat too much sodium in your diet. So whenever you are having medicines to control the blood pressure, right, it's mainly to help your blood vessels either relax or is to get rid of the excessive volume in your body to control your blood pressure. So in other words, the medicines are actually helping you. It's not like a common thinking that you're addicted to medicines, kind of like drug addiction, right? It's actually not like that. You are actually having medicines to help you to maintain the blood pressure because it keeps the piping a little bit more supple, not so stiff, not so narrow, so that your blood pressure gets controlled throughout. So most of the time, in order to come off medications, I always tell our patients, if you lose 10 kilos, right, you can actually lose 10 millimeters mercury, of your blood pressure. So I often bargain with the patients and say, you want to stop medicine? Can you lose 10 kilos? Then you can actually stop one medication. Yeah. So it's always important to also modify other risk factors and not just focus about the medications when we're talking about blood pressure management per se.
That's a very good option to decide on. Yeah. Yes, sir.
I just now referred to the phenomenon of white coat hypertension. And it is true that sometimes I prescribe medication to a patient based on the office blood pressure. And in actual fact, the home blood pressure is much lower. In that situation, I think, yes, you are entitled to discuss with the patient and say, if you can show me your readings at home and they have been properly taken, and sometimes what I do is I ask the patient to sit in front of me and then to show me how he measures his blood pressure. And if he shows to me that he's measuring blood pressure quite accurately, and he shows me his readings at home quite low, then I said, yes, I agree with you. Maybe I have a white coat effect on you. So yes, we agree to a trial or reduction in your blood pressure. And sometimes when you reduce the blood pressure, reduce the medication dosage, it remains adequately controlled, then I think yes, it's quite all right to reduce the dosage. But in some patients, when they reduce the dosage, blood pressure comes up again. So it's important that you have this kind of relationship with your doctor and discuss what you think your blood pressure is with your doctor before you try and reduce the dosage yourself.
Okay, so don't forget, audience, to discuss with your doctors if you can, yeah? All right, next question for Rachel. Now, I have arthritis and a bad knee. Means I cannot exercise, jogging, or running. But will gardening activities help to lower my blood pressure?
Okay, so for gardening, I am not a gardener, so I can't really speak on the activities that you do. But I think for exercise, normally we recommend 20 to 60 minutes of moderate intensity exercise for you to reap the true benefits of a cardio exercise, which means you're increasing your heart rate over a prolonged period of time for your own cardiac health and benefit. So if the impression of gardening is standing in front of the pot for 5 minutes and watering the plant, then that one is not. Maybe arm exercise, but that's about it. But if you're talking about really getting onto the ground, digging the soil, potting, repotting your pots, really carrying a lot of heavy tools, because I do have had clients who do a lot of gardening, so they're actively carrying very heavy pots around, carrying watering cans around. If you're really doing it over a prolonged period of time, over like 20 over minutes, and you do feel tired when you're doing it, then yes, I would say that you can count that as a form of exercise. But coming back to the question of if you're having arthritis and other forms of joint pain, then I would also like to preface that you have to be very careful, because I assume you're doing a lot of squatting, a lot of bending. If you're gardening, I'm assuming it's not raining, so the sun is probably hot. Please look after yourself, monitor your own symptoms. This is not an exercise activity that physiotherapists or we actively research on to know what is the heart response. So you'll have to monitor yourself to see how you're responding. And I would also assume that you're not gardening at this high level of intensity every other day, which means it might just be maybe once a week or maybe once or 2 weeks that you're doing this kind of gardening. It's very important to still slot in other days to do other types of exercise. You can do like what we taught earlier, chair exercises, arm exercises, or even just walking, just to clock in those minutes and to get that heart rate up over throughout the rest of the week.
I understand. So more cardio is more acceptable, I would say, not just very easy flowering the plants for just 5 minutes.
Yeah.
It's got to be more consistent on a regular basis. All right, understand. Okay, next for Dr. Lau, this is a very important question. A lot of people actually want to ask this question, so I ask first. Is it true that someone with bad temper, always angry, is often stressed and more prone to getting hypertension?
Okay, anger, emotion, sometimes even not angry emotion, happy emotion, does raise your blood pressure because your mind does respond to anything which is out of the ordinary, and that can increase blood pressure. The question of whether somebody who is frequently bad-tempered develops hypertension in the long term and becomes permanent, I have to say that the research is not very clear about it as to whether a bad-tempered person is necessarily more prone to hypertension.
All right, so take note. So not necessary. There's some good news for some of you. Like if you're very hot-tempered, then there's a bit of good news. So actually, other emotions can also trigger hypertension. Maybe being frightened, over-frightened, or being over too scared of something might also be able to increase your blood pressure, yeah? Or stress. Stress is a known fact as well. Okay, so less stress. Very good. Next to Natalie. Is it true that if I have low blood pressure, if my blood pressure is low, it means that I can have a bit more salt in my diet? a lot of people are trying to cheat in this way. Is it allowed?
Okay, so firstly, when it comes to low blood pressure, we have to understand that there can be a myriad of different factors that lead to low blood pressure, such as dehydration or even medication side effects or underlying medical conditions. So, as a first protocol, is really to check in with your medical doctor to see what is the underlying factor first before doing any intervention. But when it comes to the salt intake, actually, based on the latest National Nutrition Survey, about 90% of Singaporeans are actually consuming close to double of the recommended sodium intake. Yes. So actually, it's actually really important first to be mindful of how much sodium we are having daily, because actually most of us are having more sodium than we actually know. Because sodium don't only come from like salt, sauces, they also come from a manufacturing process such as in bread, biscuits, okay, because salt can also be used as a preservative to extend the shelf life of food as well. Okay, so salt is actually found in numerous different foods. So the amount of sodium that we require daily, okay, for our bodily function is actually less than a quarter teaspoon of salt a day, which most of us actually come close to. It's really hard for us to come close to less than that amount. Okay, so most of us are actually consuming sufficient amount of sodium intake from our diet and even exceeding. So it's very important to be mindful. But of course, when it comes to our blood pressure, it's very important to make sure that we are eating a heart healthy, balanced diet to make sure that we are getting all of the nutrients that our bodies require. Okay, because sometimes when we skip meals or maybe we are not eating a regular diet that has a heart healthy, balanced meal, it can lead to a couple of nutrient deficiencies such as maybe vitamin B12 and B9, folate, which has actually been shown to lower our iron levels and can actually influence our blood pressure lowering as well. So it's important to make sure that you are getting that half plate of fruit and vegetables, but still getting that quarter plate of lean proteins from fish, chicken, meats, tofu, nuts, and seeds, and then another plate, quarter plate for your whole grains. And also making sure that you're keeping hydrated as well, because I think a lot of us sometimes, we forget to drink enough as well throughout the day. And it's really a habit to make sure that we are keeping hydrated throughout the day, as it can also influence our blood pressure as well. And so when it comes to our blood pressure management, it's important to look at the multiple factors like what we've all shared. So it's about the heart healthy balanced diet and also keeping active and making sure you're hydrated. But if you do have any persistent low blood pressure, to really check in with your healthcare provider to understand what is the underlying cause for the suitable intervention. Yeah.
All right. Always seek professional help first, yeah? Okay, a few more minutes to go. Ladies and gentlemen, hang on, and then we'll take some questions from you, yeah? Okay, Dr. Doreen, is it true that some food or drinks can interact with hypertension medication? And should we avoid these foods? So what kind of food and drinks that may interact?
I would say, as Nestle has already said ad nauseum, a lot of the foods that contain hidden sources of sodium. Actually, do you know that sauces like ketchup and chili sauces also contain a lot of sodium? Canned foods, preserved foods. I remember I had a patient years ago who actually didn't live in a house, so he's a vagabond. And he used to eat a lot of canned foods as well as instant noodles. His blood pressure was like 200. Most of the time. So all these hidden sources of sodium is fairly important to look at as well. Remember that even wasabi has some sodium inside them. So be careful about that. I think the other concern that we see quite frequently in some references is grapefruit juice. If you take a lot of grapefruit juice in large quantities, and certain medications can cause some problems with respect to grapefruit juice intake. So be careful about grapefruit juice in your diet as well.
Okay, so that's a very good answer. Okay, a few more questions to go. This is for all to answer if you can. Anyone can answer. Can only doing simple exercises that are not too strenuous, such as walking, help me to maintain a normal blood pressure?
Okay, I think I'll take the question first. Okay, I think the important thing to take note is what does everyone on their own define as simple exercise? Because everyone's medical condition, everyone's state of health and stage of life is very different. What might be considered simple, like walking is simple for maybe someone of the 20s and the 30s, someone who's working. But if you ask someone who is, like we mentioned earlier, someone who is mostly wheelchair bound, walking is not a simple exercise. Walking is a high level exercise for them then. So we will, at least from the physiotherapist's point of view, we stick to our original plans, which is always moderate intensity. If you find this exercise at moderate intensity, then you have hit the mark.
Which means it's around 30 minutes at least.
30 minutes is the timing. For intensity, moderate intensity means that you should be able to feel like you're exercising. You can tell you're putting in effort, but you're not at a level of exhaustion.
How about housework? They do housework, cleaning, mopping, and sweating.
So housework can be considered. It can be considered. We do, especially for some clients who don't really go out much, or they know that they don't have the strength to walk for 5-10 minutes straight at one go. So they are mainly in the house. That's the maximum they can do. Then we encourage them. Then just do whatever housework you can. Vacuuming the floor can be considered very difficult because the vacuum is heavy. Mopping the floor can be considered difficult because you have to carry the pail everywhere. And at least based on my own personal experience, we don't mop the floor with a mop. We mop it with a towel. That's very intensive. It's another level of intensity. So it really differs from person to person. You also have to really see what your own condition is and whether or not it's always good to check back with your doctors whether or not it is safe for you to push yourself further or if you actually need to hold yourself back.
All right, very good. Now, question to all our speakers, or rather I would say, can all our speakers here share a tip on how to manage your BP? And then we can end our panel discussion. So each of you can share one tip on how to manage your BP, maybe in a different form, since exercise, dietitian, medicines, and maybe more information and knowledge about hypertension. So anyone can share? Maybe I can start with you again.
Sure. For me, my biggest tip would be if you're not already exercising, then just simply getting into the habit is the most important thing, I feel. As someone who didn't use the exercise when I was younger, starting exercise is difficult because I'm just not the kind of person who wants to actively go out and exercise. It takes a lot of effort. Singapore is hot. It's not enjoyable to me personally. So getting into that habit, starting it and understanding the purpose of why you're doing it, I think is the most important. It can start off as just maybe 5 minutes walking to NTUC and walking back from NTUC. But then as you build that up as a habit, where let's say you can start off like, let's say for the ladies, if you're going out shopping or the husbands are going along to shopping, you can take it as, okay, I can make a 10-minute walk every day to NTUC, maybe not every day, every alternate days. And from there, I'll just bring back a couple of groceries. So you do more shopping trips, but at least you get that walking in regularly. Mm-hmm.
Okay, so walking, one of the best, in fact, the basic exercise that most of us can do. All right, okay, and yourself?
Yeah, so for myself, I think there's a couple of little tips. So for the first one, I think go for fresh instead of processed. So whenever you can, try to opt for fresh, lean items such as sliced fish instead of fish balls, or even things like your fresh meats, fish, poultry, nuts and seeds instead of going for a lot of your processed food items like sausages, ham. You'll be surprised at the amount of sodium intake that you're actually consuming from a lot of our processed food items. And also a little tip for the next one will be to add colors to your meal. So as much as you can to add a variety of colors to your meal, meaning that most of your meals are filled with plants, like for example, your fresh fruits and vegetables, because they contain many vitamins and minerals, which are very essential to lowering our overall blood pressure risk as well. And also when it comes to our salt shakers, okay, we know that our recommendation is actually less than 1 teaspoon of salt a day. So be really mindful of that and try to experiment with fresh ingredients, like even things like tomatoes, mushrooms, okay, they can actually add really much flavors to your meals. And also things like aromatics like onion, garlic, and ginger to really bring up the flavor of the meal, okay, before reaching out for the extra salt or extra sauces and condiments. Yeah, so overall, eating a heart healthy diet. And of course, our favorite tip is to follow our SHF Heart Smart Eating Plate concept, which is a very easy visual representation, okay, because sometimes all these tips are hard to remember, but just remembering a plate visual concept of half a plate to be filled with fruit and vegetables, okay, which is about 2 fist size, okay, and then a quarter of the plate to be filled with lean proteins, which is about a palm size, okay, and then the other quarter a plate of your whole grains, which is about a fist size. Okay, so when you go out, actually, you have all this in your hands, like a karate movement, okay, because you have, all this and you can remember when you're eating out. so long you have some vegetables there, a quarter plate of whole grains, or even other products, and also a quarter plate of your lean proteins, and you are good to go with a heart healthy diet to lower your overall hypertension risk.
All right.
So I would advise everyone to see your prescriber, whether it's a pharmacist or a doctor, as your advisor rather than your healthcare provider. And why I say that is because it's fairly important for you to understand why medicines are used a particular way. And if you think you're suffering from side effects, or you could be concerned about drug interactions, certain things about your diet that may interact with your medications as well, it's fairly important to talk to your prescriber rather than stop medicines on your own. So I often get patients tell me, oh, I've got 3 medicines for my blood pressure, and they assume it's all for blood pressure, right? So in order to conserve medicine, I don't go so often to see the doctor. One day I take A, second day I take B, third day I take C. So everyone out there, you think correct or wrong? Wrong, right? Yeah, a lot shaking head. So essentially, it's important to understand the roles of various medications that you've been prescribed rather than make your own decisions. It's fairly important to see your prescriber as your partner in optimizing your health rather than, draw that line and say, oh, that fella is not going to listen to me. If I have got too many complaints, they're going to judge me, or they're going to take revenge on me by giving me even more medications, or next time they don't treat me properly. That's not how we work in the healthcare scene. So it's fairly important, again, to touch base. When you have questions, ask them, clarify to get the more information from your prescribers. Thank you.
All right. And last tip from Dr. Lau.
Okay, if you've forgotten everything else that I've told you about just now, except the number 140/90, that should be your blood pressure. In others, less than 140/90 in the clinic and less than 130/80 at home, then you are fine. If your blood pressure is higher than those reading, then make sure you discuss with your doctor what you should do about it.
All right. Thank you. All right, folks, we've ended with the panel discussion. We can take at least 3 questions from the audience. If you like to, you can maybe give us your question. You can come over to, we have a microphone there, right? 3 questions before we have our exercises and cooking demo. Sir?
Hello, I have a question for Dr. Loh. So currently, this COVID is with us, right? And there's differing stories regarding the benefits of the COVID vaccine. So I want to hear from Dr. Loh, right? Your personal view, right? I say personal view, not Akong one, because that one we know already. So your personal view regarding your understanding of the impact of the vaccine to the heart and also to the people who have hypertension.
You should actually address this question to an infectious disease doctor. COVID is, of course, a viral infection, and like most infections, whether bacterial, viral, for that matter, actually influenza, there are many complicated processes going on, and many of these processes are related to inflammation. When you have inflammation, you change the state of your blood vessels, and some of the complications of COVID have to do with inflammation of the brain. You get stroke. We know that some get inflammation on the heart. You get heart attack. They do get inflammation of the heart called myocarditis and so on. There are other effects which are not directly related to inflammation. They are related to complicated processes going on in the body, and people are still continuing to try and understand why this particular virus is causing a lot of many peculiar complications. For example, it's been reported that certain tumors seem to be more frequent with COVID, and some even claim that vaccination itself with the COVID vaccine causes some of these complications. So a lot of these things we still are not clear about. you probably would want to address some of your questions to an infectious disease specialist.
Thank you, Dr. Lau. So that means the question should be attention to the high authorities of different.
I can take the question on the COVID vaccination. So I think the key thing is you might have read in the newspapers that it causes like a leak of enzymes from the heart, like an increased risk of a heart attack. Those were actually shown to be, well, mathematically significant, but is probably not a disease state that you need to be worrying about. And if you're worried about COVID vaccination causing harm to the heart, that's probably what you've seen in reported in the public space, or even when you ask Google. I personally take COVID vaccination every single year because that's what's recommended by our government. I see the role of COVID vaccination as far more important in protecting the health of everyone rather than the risk to myself. And I think that's maybe a perspective that we all need to be thinking about. The more important question now is in the longer term when we get repeated COVID vaccination, what happens, whether it's harmful. So far, there hasn't been any very strong signals that it will harm anyone, whether it's heart-wise or any other systems-wise. So I would say that especially if there are those of you who are at risk of severe COVID infections or people at home who are at risk of severe infections, it's very important to get yourselves properly vaccinated because you could be the one to carry that COVID virus to the person who's susceptible, and that person could be very harmed by a COVID infection. Thank you.
All right. Let's take another second question. Yes. Go ahead. We have the microphone positioned in the center of the hall. Mike?
Hello. Yes. Well, actually, I wanted to ask about blood pressure. You were talking about something like, 140 to 90 mmHg, right? So regarding this, is there a difference between the two? And should we be concerned with the lower one as well? Because every time we heard about BP high, we always look at the high, but we do not look at the low. So what is the difference between the high and the low? And sometimes our high is okay, our low one that is that's supposed to be low or something that is a baseline, sometimes it goes very high up or very low below the markers that you gave us. I'm not sure you understand what I'm trying to say. For example, let's talk about 140 is to 90, right? Let's say that is the optimum, the best that you should have. But then every time when we see the doctor, we see the 140, that one, right? Then you say, okay, come out with 160. You know that that's not good, correct? Then after that, you see at the 90, we should reach around the 90. Let's say we should reach around the 90, but we did not reach the 90. We go above 90 or go far below 90. Is that a cause for concern? And how do we address this?
So
Are you talking about the people whose upper reading systolic is high, but diastolic is not high?